According to numerologists, each number has a certain power behind it, and no number is more dynamic than the number 5. It is seen as always being in motion and always in need of change, and this is why the number 5 is referred to as a dynamic force. Consequently, it is quite fitting that a dynamic force should describe the work of the Eastern Mediterranean Public Health Network, or EMPHNET, over the last 5 years. Since its inception in 2010, EMPHNET has been a dynamic driving force for change in public health by observing and reacting to challenges in the Eastern Mediterranean region, which is home to 22 countries that share an interrelated history. The public health challenges and needs in this region are rooted in the region's decades of socio-political unrest, poverty, and both man-made and natural disasters. As a result of these public health challenges, as early as the late 80s and early 90s, a handful of field epidemiology training programs, or FETPs, were launched in Saudi Arabia, Jordan, and Egypt. As these programs grew stronger, their role in strengthening applied epidemiology became obvious, urging them to form a network that can nurture collaboration between country programs and spread the experience to neighboring countries in the region. Today, EMPHNET stands as a pronounced network in the Eastern Mediterranean region, connecting FETPs in Iraq, Jordan, Egypt, Morocco, Saudi Arabia, Yemen, Pakistan, and Afghanistan, and providing them with support. Additionally, EMPHNET expanded its work during the last 5 years and now also supports countries in areas other than strengthening applied epidemiology by adopting 5 core areas. These areas are namely disease control, health security, outreach and emergency, capacity building and research, and health protection and promotion. Starting with disease control, EMPHNET works to assist countries in reducing the morbidity and mortality rates of preventable diseases, especially in high-risk communities. An example of this is EMPHNET's contribution to the global polio eradication efforts, where it collaborates with the U.S. Centers for Disease Control and Prevention, the World Health Organization, and UNICEF to strengthen routine immunization activities and surveillance activities. Other examples include working at controlling the spread of brucellosis in Jordan and Iraq, where work continues in an attempt to strengthen detection, control, and prevention of the disease. Health security is the second area that EMPHNET focuses on in an effort to contribute to the challenge of strengthening early detection and rapid response of public health threats, particularly infectious disease outbreak. Realizing the role public health professionals play in such pursuits, EMPHNET launched its Rapid Response Team initiative in 2012. Through this initiative, EMPHNET aspires to assist countries in developing national and subnational teams that can respond rapidly to public health emergencies. In strengthening health security, EMPHNET also works with countries to implement the International Health Regulations of 2005 by working on several areas such as promoting laboratory biorisk management by applying international biosafety standards to improve security. The work and technical expertise of EMPHNET in health security in the region, particularly in implementation of IHR 2005, allowed it to become a member of the Global Outbreak Alert and Response Network, or GORN, since 2012. In the area of outreach and emergency, EMPHNET works with national and international organizations.
احنا هون جينا على عيادة إنفنت المنظمة اللي داخل المخيم هون داخل المخيم وقدمت لنا مساعدات يعني احنا استفسرنا وشو كان هون انه تطعيم الاطفال وابر قزاز واستشاره مشوره للمراه الحامل وابر قزاز.
عائلتي 9 انفار معايا جينا على المنظمة اعطيت بنتي لقاح واعطيت كمان بناتي الكبار قزاز ابر قزاز واخذت انا كمان ابر قزاز.
To support ministries of health in responding to emergencies, mostly by strengthening the response to disease outbreaks and promote outreach.
بالنسبة للأعداد الأطفال اللي تم تلقيحهم في عيادة إمفنت يزيد عن 5000 طفل، وعدد السيدات أيضاً يزيد عن 1200 سيدة. تلقينا خدمة لقاح القزاز للسيدات والفتيات أيضاً من سن 15 ل 45 عام، وأيضاً خدمة المشورة ما لا يقل عن 1300 سيدة وفتاة ورجل أيضاً مشورة في مختلف الأنواع.
Over the last 3 years, IMPHNET was involved in activities targeted at supporting the Ministry of Health in Jordan to respond to the health needs of the Syrian refugees.
اجوا علينا على المدرسة واعطونا المطعوم بإيدنا. هون اجوا على المدرسة هون فاعطوني المطعوم.
يعني لما انه بتوفروا الرعاية الصحية لعدد كبير من طلبة المدرسة، هذا شيء مشكور عليه جميع المنظمات اللي بتقوم بهذا الواجب. يعني السنة الماضية كان في فحص طبي شامل، أسنان وعيون، بالإضافة لورش صحية للتوعية لأفضل الوسائل الوقائية اللي ممكن إنه إحنا نتابع طلابنا فيها. والحمد لله السنة هذه كان في ورشة، وهذه الورشة حضرها جميع العاملين في المدرسة، وتم تطبيق ما تم إعطائه في الورشة على أرض الواقع، ولمسنا هذا الأمر من خلال الاستجابة الطيبة للطلاب وتعاونوا معنا. فكل الشكر والتقدير لكم.
IMPHNET believes that public health workforce development is the cornerstone for strengthening public health system and works close with ministries of health in identifying capacity development needs. In this area, IMPHNET supports FETPs and conducts capacity building activities in areas of rapid response, biosecurity and biosafety, emergency preparedness, data management, and more. IMPHNET also supports conducting research and data analysis in an effort to promote the use of evidence in decision-making. In 2015, IMPHNET founded the Center of Excellence for Applied Epidemiology to provide training in areas of applied epidemiology, outbreak investigation, disease surveillance, rapid response, and international health regulations. Besides traditional capacity building activities, IMPHNET conducts regional conferences to promote exchange of knowledge and skills. To date, IMPHNET has conducted 5 regional conferences to provide a platform for public health professionals with access to a wealth of knowledge and networking opportunities. To promote healthy living, IMPHNET puts emphasis on behavioral change and communication activities, with particular attention on preventing non-communicable diseases. For instance, with support from the Centers for Disease Control, or the CDC, and the Ministry of Health in Jordan, IMPHNET launched a project in the government of Ajloon to prevent and control NCDs by promoting physical activity and healthy eating. Of course, we couldn't have done all of this alone in the past 5 years. IMPHNET values partnership and could not have succeeded without the support of its partners. After 5 years, IMPHNET stands firm in promoting solutions to the many challenges that face public health in the region. IMPHNET will continue to direct its efforts towards facilitating the acquisition of essential knowledge, critical analysis, and action. In doing so, IMPHNET aspires to broaden its scope with a focus on global health security.